4 gym exercises that make a disc herniation worse and what to do instead. You're going to the gym to feel better, to get stronger, to heal your back, but what if some of the exercises that you're doing are quietly making your disc herniation worse? I've seen it over and over, and I've done it myself without knowing it. Patients are triggering their L4, L5, or L5S1 disc pain with gym moves that sometimes seem totally normal. On the surface, they look safe, but in reality, they irritate the spine, they irritate the nerve, and it stalls recovery. In this video, I'm going to show you 4 or 5 popular gym exercises that could be slowing your progress, why they're a problem for disc injuries, and what to do instead, and what to look for to train smarter, stay out of pain, and prevent a further disc injury. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience, and I'm advanced certified in chiropractic biophysics. I specialize in treating neck pain, back pain, bulges and herniations, sciatica or leg pain, chronic knee pain, chronic neuropathy, and a host of other degenerative spinal conditions. I use a variety of corrective methods, non-surgical spinal decompression, and targeted exercises. Now, before I continue with this video, you know what to do. Just hit that subscribe button if you want to learn how to eliminate pain, stabilize your spine, and avoid spinal surgery so you can live stronger, longer. Now let's break down the exercise that could be setting your recovery back. Not only will I show you the 4 movements to avoid, I'm also going to walk you through some replacement exercises you can start using today to protect your spine and strength the right way. Now remember, timing is crucial. If you hurt your disc today, what you can do in 3 months, what you can do the first 30 days, what you can do the first 60 days makes a difference. So some exercises are dangerous now, but in 3 months or 6 months, we can gradually test them. So I'm going to assume most of you have a fresh injury, and we want to be very safe in the gym. So if you've paid attention to any of my old videos, but if you haven't, if you're new, bottom line is this. We don't want to flex the disc. We don't want to bend and twist the disc, all right? Particularly at the beginning, the first 3 to 6 months after an injury. We want to let that disc heal and kind of scar up a little bit. So this exercise, a Russian twist with a weight, I would not do. I probably would never do it at any phase, but I certainly wouldn't do it in the first 6 months because we're creating flexion and twisting. Not good. What is a safer way to address the front or the core? The core is the front muscles, the side muscles, and the back muscles. A safer way is something called a Pallof press. What this is doing is, this is a anti-rotation. So in other words, I'm avoiding twisting right and left. And you would push your hands forward, kind of like this motion. You would hold there for 5 seconds. So a Pallof press, I have a band, I push, I tighten my stomach, I tighten my butt, and I avoid rotation. And you should do it in a way that it has 0 pain. And if you can't do it in the first couple weeks, then I would avoid it. So generally the first week or 2 after a hot disc, you're going to do real gentle motion. Just some general range of motion. You're going to find ways to eliminate that pain. And some people it's leaning back, some people it's lying over a football, but down the road we want to address the core. Now let's look at some other common exercises, and I'm going to give you my 2 cents. All right. So the next thing we want to avoid is flexion. Now this is a terrible picture of someone squatting. That looks bad. In fact, you should never do that. All right. This is creating rounding of the back. That would kill you with a disc herniation. All right. So what will we do instead of squatting? Well, the safest thing would be a neutral spine. That means the spine doesn't move. And this would be a Bulgarian split squat. Now, if that's too hard for you, and I certainly don't recommend holding weights at the beginning, especially not the first month or 2. So you're going to do a modified version of that where you can do this exercise and have it next to a support where you can put your hand down and give yourself a little support. This would be a great substitute. All right. Now, down the road, we also can do a hack squat where your back is completely flat. That's the how exactly, and you make sure you move in a way that your back does not round. Okay. Now, what else would we want to avoid? Bent over bar rowing. Great exercise, but high risk for most people. Particularly if you have any back pain, particularly if you have a history of a herniated disc. If you have pain while sitting, I probably wouldn't do it. What could you do instead? You could do a one-arm row where you support your arm, or you could do a machine row right here. Very safe. You could do this probably after the first week or two of injuring a disc. I did this myself within probably about a week into a disc herniation, week to 10 days. All right. So pain-free. This is a machine. There's a support in your chest. Now, what else could you do that's safe? All right. So we avoid the Russian twist. We could also do a plank. Make sure it's pain-free. And what else would I avoid? I would avoid, this is a picture of a leg press. And if you see here, his butt is coming off the table, creating flexion. It's hard to see in this, but I would avoid a very deep leg press right away. I think it's much safer. See that round of the back? That's rounding right here. You could do a partial range of motion on the leg press, where you use less range of motion and make sure your back stays flat. Your back should never come off the back pad of a leg press. So what do we do instead of leg press? We do the Bulgarian split squat. All right. Now, what about the rowing exercise? We don't do the bent over row, but we could do a horizontal row using your body weight. This is a great exercise. This is using all the back muscles in a safe manner. There's no flexion. There's no compressive loading on the spine. I would avoid deadlifting. Now, could you do this 6 months after an injury? 6 to 8 months? Yes. Notice that we're starting from the knees here, but I wouldn't do that right away, okay? So I definitely would not do deadlifts from the floor, especially if you're not flexible. Eliminate deadlifts. Now, some people, depending on what degree, how much space you have in your disc, what degree of a herniation you have. So there's lots of factors should you deadlift. Great power exercise, but for some people, there's better things you could do. Less risk, all right? So what's less risk? Less risk would be a partial glute ham raise, okay? This would be a great substitute. And I would keep the range of motion small at the beginning, all right? Notice he's not going all the way down. He's partial. Now, look at this. This looks similar, but notice there's a little bit of rounding in the lower back. So I would make sure the pad that your hips rest against are on top. All right? So we're avoiding leg press. We're avoiding bent over row. We're avoiding the Russian twist. Okay? We're avoiding deadlifts. And instead, we are doing a extension maneuver in a partial range. We are doing a Bulgarian split squat. And I would start off at 3 sets of 10. And before you add weight, I get up to 3 sets of 30, 20 to 30 reps. All right, that would be a great. This is another safe. This is a curl up. Notice she doesn't move much with the curl up. 6 to 8 months down the road, if you want to do deadlifting, if you feel it's absolutely necessary, I would start from the knees up. Notice we're starting from the knees up. Notice his back is straight, chest out. There's no rounding of the back. All right. And if you could do this well and you gradually progress over months, maybe you could go a little deeper, but be cautious with that. I highly recommend this exercise, horizontal row. Great exercise. And if you want to progress this, you can elevate your feet so your feet are horizontal. You can put it on a block. I do that twice a week. In fact, when my father was alive, when we worked out together, he was doing it with his feet on a block almost up till he was 90 years old. A very safe exercise, and it's great. It works all the muscles that keep you upright. We got rowing, we got plank, we got partial range of motion, glute ham machine, we got Bulgarian split squat. Those are the things you want to do. We want to avoid the flexion. Anytime we bend that spine, we want to avoid deadlifting from the ground. We want to avoid deep leg presses where your butt comes off the ground. We want to avoid full range of motion, at least at the beginning. We want to avoid anything that looks like this when we round the spine. And this is a rough exercise. Again, very beneficial for power, absolutely. But is the risk-benefit ratio worth it? All right, so remember, the type of exercise you do, how heavy you do it, when in your phase of recovery, the first 4 weeks, the first 8 weeks, 12 weeks, 6 months, where are you? And do you have a history of chronic problems? Or is this a one-time issue? Take that all together. If you follow some of the recommendation I make, I think you're going to do great. Now you know which gym exercises to avoid if you're dealing with an L4, L5, or L5S1 disc herniation. They may seem harmless at first. You may see a bunch of other people do it, but they can compress the disc. They can stress the disc, irritate the nerve, stall the recovery if you keep doing it. And more importantly, you now have over 4 safe, effective replacements that can reduce disc pressure, strengthen the stabilizing muscles around your spine, and help you stay active without triggering more pain. Try them out and tell me in the comments which one felt the best for your back. Pay particular attention to the Bulgarian split squat, which I love, and the horizontal row where you're using a bar and you're lifting yourself. Now, if you like this, do me a favor, like and share this video. If you've been frustrated with gym workouts that keep flaring your sciatica or back pain up. And subscribe if you want to train smarter, stabilize your spine, avoid surgery, and finally start making real progress with a disc recovery. The next video you should watch is this one right here. I'm going to show you exactly how to relieve pain from an L4, L5, or L5S1 disc bulge or herniation using very specific targeted lower back exercises that are designed to support healing. Go watch this video next.